First of all, welcome to Rhode Island. How's it been so far?
Amazing, and I'm not just saying that the food, first of all, is the best part of being here. The restaurants probably gained about 30 pounds, but I love the oysters. And surprisingly, I don't know why this surprised me, but everybody's been incredibly warm and welcoming. So that really has made my stay here, my welcome here, very warm and nice.
So now that you have been here for 6 months, how would you describe the current state of the child welfare system in Rhode Island?
In transition, I think is the best way to describe it. You come into a role like this where former acting director Kevin Alcoyne really kept the ship moving, right? And so as you come in, you identify that it's a lot of balls in the air, a lot of things that are moving forward that can't stop just because you're new to it. And so what I found is I had to come in and really hit the ground running while also going through the process of learning the needs of the community, really engaging with the staff and understanding how and what the culture of the department is and how we can improve that. So people are excited to work for the department, people are excited to stay. You really tap into that passion and the reason why you're really engaged. But also thinking about big picture vision and where you want to see the department go, and having people's voices be a part of that larger vision for the department. So as I see it, we're in transition from things that have been going well, things that have not been going so well, and really thinking about how you propel the work forward. So,
what do you think is going well?
Well, I have to really highlight the work that Rhode Island does around prevention. Coming from Illinois, where I think that they do a fine job with it, but I really saw some areas in which they needed to improve, specifically around moving support further upstream, to come to a state where they have a warm line as opposed to just the hotline was actually pretty intriguing and heartwarming for me. And so that warm line is our support and response unit. And so when a family is struggling and they just need help, they don't have to call the child abuse hotline to ask for help. They can actually just call our support and response unit and say, here's what we need help with, how can you support? And that support and response unit will refer our families out to our family community care partnerships. We have 5 of them in the state. And they can go to the family community care partnerships, what we call FCCPs, and get support without having an open case with the department. And that's a really strong value of mine. I really value how we can support families in the community without them having to have formal involvement with the child protection system, which can be quite traumatic. And obviously, when there is a situation where kids there is a legitimate concern for abuse and neglect, being able to rise to the occasion, assess the safety of the children, determine what the capacity is for the children to be remained in the home is also equally important. But I really love the work that we do around supporting families in the community. And as a result of the support and response unit, we've seen the number of calls to the hotline decrease and the number of calls to the support and response unit increase. In addition to a door closing in terms of how many youth are coming into foster care, which is also a strong value of mine.
So it's really catching a problem before it becomes a crisis?
That's right. And that's how we better support families. That's how we ensure that children's needs are met, that families' needs are met, that we're looking at the whole family, and that we focus on how to make the family thrive and just not survive, right?
And it builds a trust too, doesn't it?
Yes. There's a huge trust crisis in general with child welfare systems across the state, across the nation. People don't know us. They don't know really what we do. And you ask anybody on the street, when you think of DCYF, what do you think of? And it's most likely going to be that they say they take kids, right? They don't understand. I think people don't have the context and understand that there's so much more to our department than just removing children. It really is about helping families sustain themselves and be at home and be supported without our involvement. That's really what I hope to move forward.
What is one thing you've identified that you say, I got to get to that right away, that deserves my attention?
Mental health concerns, whether it be, substance abuse, any sort of mental health need that they might have. I really want to see our service array and support for those children be expanded so that and really think about how we do that further upstream as well, so that we're not having kids that require congregate care settings, right? While it's very important to have a group home or a residential treatment facility as a short-term intervention for kids, that shouldn't be the solution for addressing a mental health need that one of our children have. They shouldn't have to come into our care for us to be able to provide that support and service. So really truly being able to identify when they're 3, 4, 5, or 6 and that happens, how we can support that youth at that age in the home and really give them the support and services that they need, so that we're not seeing them at 14, 15, 16 in our group homes and in our child welfare system, in our residential treatment centers, and essentially sometimes even aging out. So I really would love to see us have a deeper assessment of the needs early on for our families and our kids, so that that's not happening.
Do we have enough mental health services for our children?
It could be enhanced, and we're actually in the process of undergoing a contract and procurement process. So we're really looking forward to seeing what might yield itself from that process. We're really looking for bold, innovative, outside of the box approaches to programming and therapeutic supports and services. And so I'm really hoping that as we go through that process, we'll see an enhancement in the amount of mental health services and supports that can be offered to our kids. As it exists now, it works. And I think that, to a large extent, especially when I think about mobile crisis and the work that our mobile crisis providers are doing for our kids who are struggling with acute mental health needs, like at that moment, I'm really excited about seeing that potentially grow.
How is that working with a collaboration with Family Court?
I appreciate that question. I actually, to be frank, when I first came to the state, I would hear rumblings that there was, to some extent, a really good collaboration, but also equally a strain between the Family Court and the department. And one of my major goals was to establish a really good working relationship with our Family Court judges. I'm a collaborative problem solver, and I think the best way to address the concerns that we all have is to do them together. And so I was really intentional about reaching out to folks like Judge Stoltzatz and Chief Judge Ford and Judge Ortiz, Judge Nike, really trying to connect with them, let them know what I hope to see happen with our system, how we can do that together, and also figure out ways in which we can enhance that. It's currently a work in progress, and I'm looking forward to all of the work that we can do moving forward. I'm really in love with the Safe and Secure Baby Court that Judge Stoltzatz oversees. She really works with our young adults and our adult families who have little children, and her main goal is getting those kids back home, and that's completely aligned with my goals and values when it comes to preserving families and supportive reunification. So being able to see a family court that is engaged as they are here in Rhode Island is sort of unprecedented. Where I come from, it's not that it's not that strong. I feel like sometimes our judges, they almost put on social worker hats in the way that they're engaged with our families and our staff. So,
one of the biggest issues facing the country and the state right now is homelessness. I know of 3 children who were in foster care, never got adopted, and who are living out in the streets right now. What are you going to be doing to try to address that issue?
Well, actually, as I onboarded, I learned that under previous Director Alcoyne, under his leadership, they had offered support through the coordinated entry system for homeless families. And so what we would see around that time, I think it was sometime November of 2022, notification was made to families that, hey, if you're living in an uninhabitable situation or an unsafe living situation, we would offer support through our family community care partnerships and by way of putting families in hotels. So over the last year, families who come to our attention after we've helped them exhaust all of the options that are available to them, do you have family out of state? Do you have families in state? Can we help you pay last and first month's rent? We would exhaust as many options as we can as possible before getting to the point of saying, well, if you don't have a place to stay, we don't want you on the street, so we will put you in a hotel. So that's been, it was meant to be temporary in the hopes of, obviously working to find more long-term appropriate housing solutions for families, because a hotel stay is great temporarily, but for a year, it's not sustainable, right? So better than being on the street, but we also want to help families transition into more supportive housing. So we actually have a whole team of people, including one of the honorees today, one of the award recipients, Joan Harmon, who's taken the lead in supporting families specifically who are involved with DCYF, with helping and assisting with hoteling and that process through her support and response unit. But also outside of that, I give major credit to our family community care partnerships who've really stepped up to provide that support through the hotels and other shelters. So what you'll find is the families, we have about 140 families right now that are currently hoteled. And they're supported through the family community care partnerships, and they're being wrapped with services and supports and housing navigators so that we can get them transition to housing as quickly as possible. And also, we're currently having a strong collaboration with the Department of Housing. Secretary Pryor and I and his team, along with the governor's office, have been working on in a coordinated effort, probably on a weekly basis, really thinking through a plan that specific to family homelessness, to again help bridge that gap for families and keep them out of the elements during the winter. Specifically.
When it comes to homeless former foster children or current foster children or runaways, what is the long-term plan as far as getting them in a permanent situation?
Absolutely. Working with our providers. When I think of youth homelessness, I think of community providers like Foster Ford, Lisa Gillette, who's doing some phenomenal work with supporting our youth who need supportive housing. And so really finding opportunities to collaborate and work with her, and also helping to be a voice for advocacy around enhancing those supports for her. We have our voluntary extension of care for youth who are aging out, that sweet spot between the age of 18 and 21. I don't know about you, but when I was 18, 19, 20, 21, I still needed help from my family. And so...
and your whole life you need a family?
Oh my God. I think it was about 30 until I stopped calling my parents for money. But the idea is that just because they turn 18 doesn't mean they have it figured out and they're ready to go. We don't, we should do a better job, and I think we have, through the voluntary extension of care program, of equipping our young people with the independent living skills necessary to make sure that they're successful long term. So through previous leadership and my leadership, we hope to continue to support our youth in that transition from foster care through adulthood. I'm really passionate about having youth voice be a part of this process as I begin to form our vision for the department. So really centering their voice and hearing what they have to say about how they experience our care and what their needs are is going to be really important to me. And my hope is that through understanding those things, we can transform our practice to meet that need.
What do you think is causing this crisis in our country right now?
Oh, that's a loaded question, because I think it could be a variety of things. I think of people not having their needs met. Concrete economic supports as a basic tenet of having to make sure that that their needs are met. We know that when families have access to, income, at least a guaranteed income of some sort, when they have access to food, clothing, housing, they're more likely to be successful. We will see less children come into foster care, less children maltreated when those needs are met. And so I think what we're experiencing is not only a result of the effects of the pandemic and the workforce crisis that ensued from there, but the use of the expansion and the use of drugs like fentanyl, for example. And so I think it's a variety of things why people are in some of the situations that they are, but at the root and cause of it is, wanting to make sure that families can work. I mean, I guarantee you there's a larger amount of families who would prefer to work and have money and income and to support their families so that they can have those needs be met than not.
What do you think is causing the mental health crisis among children right now? We see so many children who are stressed out, depressed. 1 in 5 has a diagnosed mental problem. What's feeding that?
I think the pandemic actually has an incredible impact on it. I have a daughter, she's 15 years old. And she and I were having a conversation, and I said, are you, she's new to the community just as I am. I said, are you making friends? How excited? Like, have you sat down with kids at the school lunch table? And she says, Mom, everybody has their AirPods on, they're in their phone. There's no way to tap someone and say, hi, my name is. It's incredible. People are so consumed in the phones and social media. I think that has a lot to do with it, and I think part of it is that for a year and a half or 2 years, they had to do school from home, and they didn't have those interactions with their peers. So at that time, my daughter was 12, and so now she's a 15-year-old, and I would imagine that kids are struggling with that transition of coming back into an environment where they're having to interact with people. Or their peers, and really understanding and knowing what that means. So I have a sense that the pandemic has truly contributed to some of the issues around mental health for our young people.
So it's really time to get back to eye contact, family dinners, and doing things with your friends that don't involve some machine.
Yeah, exactly. And I think to some extent it's always existed, right? I think we can blame a variety of different things as to the reason why our kids are struggling, but I think the most important part is making sure that we have the services, once it's been identified, that can and will support our kids through whatever they might be feeling for whatever reason. That's why it's so incredibly important to have those services and supports available to them.
DCYF has been criticized in the past for not having adequate mental health services available for children who need it. What's being done right now to make sure that they do?
We're actually in the process of developing two phases of of a comprehensive needs assessment. One will be an interim assessment where we'll, because the need is now, right? A comprehensive assessment could take a couple of years. We have to go through a procurement process. We have to develop the scope of work. We don't have 2 years, right? But that's very important. Having a comprehensive assessment of our needs is critical. But in the meanwhile, I have my team working together along with the Executive Office of Health and Human Services of developing an interim comprehensive needs assessment so that we can be able to identify where our gaps are. For instance, we don't have substance abuse treatment residential facilities for young adults in the state of Rhode Island. We need that, and so we're working, directly with EOHHS and the adult behavioral health system to identify how we can create that or fill that gap in our state. So at this point, from my perspective, it's really about understanding what we do have, what we don't have, what the need is, and how can we rise to the occasion and get it met.
There are passionate people. There seems to be more money than usual to deal with things. Is the problem now not having the trained professionals in the field that are needed in mental health?
I think that's an aspect of it. I think, and I hate to keep blaming the pandemic, but there's a lot that has come from the pandemic, and part of it is a lot of our trained clinicians that would typically either be in, work for our residential treatment facilities or our group homes or even our providers, find value in doing telehealth and working as a private therapist. I mean, think about it. It's comfortable to be at home and meet with a client and provide that direct one-on-one support, as opposed to sometimes having to be in a residential treatment facility, having to block hits and sit down and really engage with kids in a way that can be quite challenging. So I think what the pandemic has shown us is that there's other ways to work, and unfortunately we're seeing a field where people are, leaning more toward that, which is creating it's creating a workforce crisis in the health and human services field, sort of holistically.
What is the one goal you have, say for the next 6 months, that will help children have successful lives?
Oh, I love that. So one goal in particular, and this is extremely important, I'm in the midst of operationalizing a listening and learning tour. The first phase of our listening and learning tour is actually internal. So it kicked off in October, and through the end of December we will have met with every division within the department. And I decided to start internal because, one, I value my staff, and I want them to know that I value their thoughts and their opinions. I want to know what they feel is working, what they feel is not working, and what they feel they need to be successful in their roles. And so we're currently in the midst of that listening and learning. I think it's added great value. One, they feel heard. Two, we're identifying short wins, things that they're saying, I'm like, I can fix that with a signature, no problem. And then also identifying those more painful sort of points where I know we have to really dig in and do some work on. Come January, we're going to be turning outward to our community, really going back to centering youth and family voice. I really want to hear from the community, people who have been touched by our system, who are at risk of being touched by our system, those children and families that are currently involved or have been involved. I want to hear from them. So we're really excited about kicking that off because we have some hard things we need to hear, but that's okay. The work that we do is amazing and we love it, but it's not always perfect. And so what is it that we can do better so that we're better serving kids and families and people see us as a helping system as opposed to a harmful system? The listening and learning tool will also include our other community-based partners, our tribes and other affiliations, our legislators, our family court. So anyone that has some sort of touch to our system, we're going to be listening to them. And what I hope that will come from that is really an opportunity for people to feel like they have a say in what our overall vision will be for the department moving forward. I'll establish a steering committee that will include all of those stakeholders to some extent. And then we'll really take a look at everything we heard, both internally and externally, pull out those major themes, and then from there be able to concretely come up with solutions to some of the really difficult problems that we've all identified. And some of them won't be as difficult and can, again, be easy wins. And so from there, we'll turn that to a larger strategic plan that's going to be public facing. And honestly, it'll be an opportunity for our children and families, our staff, and our stakeholders to say, hey, Ashley, you said in 2 years you would have this done. Where are we with that? Mm-hmm. And that steering committee will be a part of making sure that we're moving that work along that we've identified that we need. So that's what I'm most excited about, because that will in turn lend itself to making sure that our staff are grounded in the practice of our guiding principles, that we're not just saying it, but we're being about it. Like what are our vision? What is our vision? What is our mission? What are our goals? And really doing the day-to-day work to move us toward that. And that's going to lead to better outcomes for kids and families.
So your goal is to have a strategic plan. Who's been left out of that plan in the past? I'm not sure I'm familiar with how they've done strategic plans at DCYF here in the past. It's my understanding that a listening and learning tour had been done at some point with a previous director. And then my question to my staff was, that's really great, but what came of it? What changed? And then it was kind of crickets. And I said, that's got to be the difference. We can't just listen to listen. That's just disingenuous, and people won't like that. It's not the right thing to do, and also people will notice if you're not listening. So we got to be about it. We really have to put our money where our mouth is and listen and learn and move the work forward. You talk about your strategic plan and how you want that to work, and you are including families and children in this.
Yes. So I can't wait. I'm already having conversations with my public information officer about how we get that word out. Who do we need to go to? News stations or radio stations and really get the word out in people's languages and languages that they can understand, so that everybody can have a voice at the table. Because at the end of the day, when we have that vision that's established, or that mission and that guiding principles, people can say, I was a part of that. I had a voice in how that was created, and the director heard me say this, and I see, oh, right there in that strategic plan, when I said that on November 15th of 2023, she included it. So I'm really excited about people having their voice be heard through that process.
What problems do you see trending right now?
Oh gosh, so within the department, I'm assuming you're,
yes.
Okay. Placement, in terms of our children with the most acute needs. Some of it is so severe that sometimes we don't have providers who can meet that level of need for our kids. And so we're finding that we have to go outside of the state, right? And sometimes outside of the state is right across the borders. The majority of our kids are probably within a 50-mile range. And it's still out of state, far from family is still no good. But sometimes I think that when people think of our kids having to go out of state, they think of thousands of miles away. Now, there are some children who do have a very specialized need, right? That might be that one youth with a severe eating disorder and diabetes with schizophrenia. That's very specific, right? And there are only a few providers across the nation who can meet that very acute need, and it just can't be managed here in state. So that tends to be a challenge for us, really trying to make sure that we're not keeping our kids in hospitals beyond the time that they need, really trying to find that provider that can meet their need and having them transition successfully in to get that support, and also that it be time limited. I don't want kids to age out of foster care through a congregate care setting. It really should be a short-term intervention, and us working to transition that child to a community-based service or support that can help them, like a therapeutic foster home or back into their biological home, as opposed to staying 2 or 3 or 4 years in a residential treatment facility. So that's something that I see as a trending area and need for us, that we're really being thoughtful about.
And what advice would you give to parents?
When you notice those behaviors early on, reach out for help. That is the time. As if you see something that just doesn't feel right, or there's a behavior that doesn't seem exactly normal to you, especially if it's even at the ages of 3 and 4 and 5, reach out for support. Call our support and response unit. Say, hey, my kid is experiencing this. I don't quite understand what's going on. Is there someone that that can help me? Because guess what? We'll make those referrals to the right people so that the child can be assessed and the family can be wrapped and supported in a way that could potentially prevent a situation where we have a youth that needs to go to Florida to have a very specialized need met, right? So I think sometimes calling DCYF feels scary.
Mm-hmm. They don't have to worry about that though with this.
No, not with our support and response unit. You don't be afraid to call and ask for help, because really our value set is around helping families and making sure that I don't want you to come into care if you don't have to. I'm a real advocate for preserving families and only absolutely removing children when there's a safety need. And anytime we can keep families in the home, we want that. So I really want to spread that message far and clear that we want to help. We want to be a helping system, not a hurting and harmful system.
And finally, you've stepped up to the plate to do a very tough job.
Yes.
How do you stay strong?
Oh gosh, I compartmentalize. I watch movies with my daughter. Self-care is really important to me. What they say when you get on the plane, if your air masks come down, put yours on first, then help the next. So I'm really thoughtful about making sure I put my mask on first, and I try to spread that message to my staff too. It might be times in which I have to work at 9 o'clock at night or on the weekends, but if I see them on email, I'm telling them to get off. You're not me, get off of email. So I try to be really thoughtful about self-care, and I love spending time with my daughter. So.
Good. Well, thank you so much, and welcome to Rhode Island. We appreciate you being here and helping us.